Hi, my name is Dr. Schleider. I'm the owner and the founder of the Non-Surgical Spine Care Center located in Orange County, California. And I just wanted to talk to you today about a few of my passions. I've been in practice 38 years. This practice that we have here is now 20 years old. It has been the greatest part of my life and my career. I get to see people stay off surgery tables, hence the name Non-Surgical Spine Care Center. It is a wonderful, wonderful thing. You know, every one of you out there knows somebody or somebody's family member that has had a spinal surgery that's failed. Why is that? Because it's the highest failure rate of any surgery that we do on a human being. More than anything, you don't hear failed hip replacement surgery, you don't hear failed knee replacement surgery, failed coronary bypass surgery. Yes, there's failed hip replacements. Yes, there's failed knee replacements. Yes, there's failed coronary bypasses, but not to the point where they make a title called failed back surgery syndrome. There is no syndrome for them, only for spine, because it's the highest failure rate. When you look at two vertebrae, when they move, there's very little movement between two vertebrae. When you look at the movement of all the vertebrae together, orchestrated, it gives you a lot of motion throughout your spine. Well, what do? We fuse two of those vertebrae, or three of those vertebrae, or four of those vertebrae. And that makes the vertebra above have to work harder. It makes the vertebra below have to work harder. And what do you have? Another blown out disc, another surgery. It is ridiculous. We've been doing the same surgery for 60 years. More now than ever, with a higher failure rate than ever. It makes no sense. This is the 21st century. It's actually ludicrous. It's actually criminal. We see people come into me and say to me, I'd like to do something non-surgical. And I ask them, what's your height to weight relationship? And they'll say, I'm 5'4", 185 pounds. Do you have high blood pressure? Yes. Do you have type 2 diabetes? Yes. Do you have high cholesterol? Yes. Okay, that person, their chance at 73 years of age of having any efficacy is 0 and none. Here's what I say we should be doing. There should be a number system between 1 and 10 that the insurance companies go ahead and design. And you have to be at least a 7 to be able to have the insurance company pay for the surgery. You can go pay the $100,000 yourself if you want to any doctor, they'll do it for you. But you got to build into it a fact that this patient's going to fail. If they're 184 pounds and they're 5'4" and they got high cholesterol, high blood pressure, and worst of all, type 2 diabetes that don't heal well, this person's not going to be able to rehab. This person doesn't have the recuperative factors that they used to. This person is going to fail. I know I get very passionate and I talk fast, but this is how much I believe in this. We do non-surgical spinal decompression therapy. This was developed by 2 medical doctors back in 1996. We have not tens, not hundreds, but thousands of people we've kept off the surgery table. We're the only clinic in the world that does not have a finite amount of time to treat you. I mentor doctors all the way around the country. Somebody will say, it's 24 visits for this much. Okay, I don't have a 24 visits. We treat until we reach maximum medical improvement. Whether that's 40 visits or 60 visits or 80 visits, we keep working till we reach our maximum medical improvement. Second thing we do different than anybody else in the United States is at the end of the course of care, according to the 2 medical doctors and 2 neurologists developed this in 1996, once you're well, go enjoy your life. Well, since I don't have a crystal ball, what I've added is lifetime rehydration, which means at absolutely no cost to our patients at the end of their course of care, if they so desire, they can come back once every 8 weeks for the rest of their life, do the pre-therapies, do their decompression therapy, do their post-therapies, go back out, live their life again. We don't charge a dime for the opportunity to stay well. We want to get them well. We want to keep them well. We want to be like thousands of people before them are well. Here's the bottom line. I don't charge a dime to teach you. I believe everybody needs to make an educated decision. Unfortunately, there's a lot of scare tactics that the surgeons will say to get people to do their surgery. This is one that I can't even believe I heard. I would think it was a joke if I didn't actually have it. A young girl that came in here, I mean young, like in her 30s, she was told by her surgeon if she didn't have surgery by the end of the month, she'd be paralyzed. So she went ahead with the surgery. She's scared stiff. She doesn't want to be paralyzed. Comes to see me 6 months after the surgery, and I said, how are you feeling now? She said, my right leg pain is 10 times worse than it was before the surgery. Did you go back to your surgeon? Yes, I did. What did he say? He said, you're not paralyzed, are you? I mean, that's the mentality that's used. A lot of scare tactics. There is no secondary negative effect to anything that we do in this practice. There's a word called iatrogenic. It is a condition which is caused by the treatment of the original condition. We don't have any negative side effects. We have no secondary iatrogenic conditions. Take the opioid epidemic. Put a person on opioids, they get kidney and liver problems and narcotic addiction, you take them off, their back is exactly like it was. We rehydrate discs. We do this day in and day out. I would invite you to call me. I would invite you to speak to me on the phone. If nothing else, I'll do a phone consultation on you. I would invite you to come in where we do weight-bearing digital x-rays. We'll show you our 5,000 square foot facility. You'll meet other patients under treatment. You'll meet the rest of the staff, and you're going to spend with me probably an hour to an hour and a half. You're going to get more education on what we do than any other doctor that you have ever seen, bar none. It's sent to me every single day. I really would love to hear from you. Please give me a call. Please reach us online. Please save your life or the life of loved ones, and let us give a try to see them. I don't take on anybody that I'm not assured that we can help. Have a wonderful day. This is Dr. Schleider.